I'm Dr. Joseph Shehadi, neurosurgeon and the founder of Northtowns Neurosurgery. And here at Northtowns Neurosurgery, we take care of patients with brain problems and spinal problems, as well as peripheral nerve problems. That means concussions, brain tumors, brain hemorrhages, and then in the spine world, there's the cervical herniated discs, the neck pain, the arm pain, the low back pain, the lumbar herniated disc or slip discs. And then in the peripheral nerve world, it's the carpal tunnel and the ulnar nerve. I've had the privilege of training at some of the world's most elite institutes, including Harvard, McGill, University of Toronto, MD Anderson, Washington University. And at this point in my career, I've decided to move back to my hometown of Buffalo, New York, and finish out my career here around friends and family and loved ones. I greatly respect and love Buffalo as a community, and I'm proud to bring that training and 20 years of private practice experience that I had in Columbus, Ohio, right back here to my hometown. Conditions that I treat most often would be spine disorders, more so than brain, even though I had special training on brain surgery, brain tumors, epilepsy surgery, brain hemorrhages. But if you zoom out and look at the big picture, spinal problems are at least 10 times more common than brain problems. So to speak about common problems, I would easily say that it's neck pain, cervical herniated discs, cervical fractures, cervical stenosis, cervical radiculopathy, as well as lumbar or low back problems, namely low back pain, lumbar radiculopathy, herniated or slipped discs, spinal fractures, spinal instability, chronic low back pain, etc. So I would say that would be my answer to what do I treat most commonly at my practice. I take a thorough history. I do a complete neurological and physical exam as necessary. I look at any and all relevant films and diagnostics. That means MRIs, CAT scans, X-rays, and EMGs, nerve conduction studies. We definitely listen and we treat the patient as if they're my family members. So I give honest medical advice with the patient's best interest at hand. And in general, I'm very conservative. I always start with conservative treatment options and save the more invasive treatments for later. Therefore, I start with chiropractic care, physical therapy, medications, cervical or lumbar braces, spinal injections if needed, and then last but not least, spinal surgeries. And in the spinal surgery world, we do all the approaches, anterior, posterior, lateral, all the using the latest technologies. And we have, fortunately, very good outcomes. A common misconception about spinal surgery in general is that spinal instrumentation is bad and it's going to lead to chronic pain and it's going to be a failure. With the advent of spinal instrumentation and all of its advancements, the titanium, the neuronavigation, it turns out that it's becomes quite good, and patients do a lot better than they think they're going to do. So I would say that would be one of the biggest misconceptions about spinal surgery in general. When I'm encountered with a nervous patient, I try to reassure them and give them confidence. I show them that I care, number one. Number two, I listen to their complaints, because most patients don't feel listened to by other healthcare providers. And I take pride in that. And that's why I take so much time with each of my patients. But I think the fear is usually from the unknown. And so I offer them a lot of information. Number two, I allow them conservative and intermediate and invasive treatment options, and I meet the patient where they're at. And thirdly, I emphasize the fact that I've had over 20 years of experience, closer to 25 years of experience, and I trained at some of the best schools in the entire world, not just in the US. McGill in Montreal, University of Toronto, Harvard in Boston, Washington University, St. Louis, and I did 19 years of level 1 trauma, and I've been the director of neurotrauma at Grant Medical Center in Columbus, Ohio. So when I give them this background, it's not to boast, it's intentionally to provide them with confidence, because if they see that the surgeon is very educated, experienced, and confident, that helps them ease their anxiety.